Uganda, with one of the youngest populations in the world, has a correspondingly large number of adolescents at 16% according to national statistics. In Lira and Aleptong districts, early initiation into sex by adolescents is a cause for concern amongst parents and the communities, with 52% of boys had initiated sex by the age of 18, as compared to 43% of girls. The study found a huge unmet need for health services amongst adolescents, with 88% of them indicating they were willing to seek health care and disclose sensitive information to healthcare providers in health facilities regarding reproductive health if the services were more accessible and youth-friendly. The Adolescent Sexual Reproductive Health and Rights Project, targeting the adolescent girls and boys, came at the right time of need. The project has used multimedia channels and has used peer-to-peer approach to interact with over 32,000 boys and girls.
This project in northern Uganda is being seen as a model project because of the unique approaches that are being used in it.
We are using the Pathways to Change model, the conceptual framework that recognizes the continuum of change, the steps to behavior change from unaware to aware to ready to change to action and to maintenance of behavior. And it recognizes that the individual is surrounded by the environment, and a conducive environment is necessary for this young person to change behavior. So we address the community and family, we address the social services, we address the social-political level or the policy level.
The project has used tools and techniques, including radio talk shows, debates, print materials, school drama competitions, and talking compounds. The most important channel has been interpersonal communication, where a team of 94 peer educators, they use simple, low-cost tools that are very popular and impactful.
When CDFU came, they helped us to reawake us, and we are happy. We have registered down the new peer educators who are now steering the program.
The sexual network game is perhaps the most popular tool that has been used. The game helps individuals to visualize multi-sexual relationships, the underlying factors involved, and consequences. It triggers individual introspection of his or her behavior, assessment of risk, and promotes intention to protect him or herself from pregnancy and sexually transmitted diseases, including HIV.
There were 3 colors meaning different things. The red thread was meaning partners who have sex without condom, and the blue thread was meaning partners who have sexual intercourse with a condom, and the white one is faithful to only one man, and that only one man is faithful to only that one woman. The people who are having the sexual intercourse somewhere else can get involved, can be connected to those ones whom they don't know, but they can still be infected with the infections that their partners have, though they don't have sex with them physically.
I had been having very many boyfriends and boy lovers, and afterwards I got into this network game. I realized that I was not faithful to myself, and I started to abolish all those people. I said that I should now decide for myself to take the right position for the betterment of my future. And now have made up my mind to be faithful to myself and abstain.
I was having four girl lovers. I played sex with all these girls. Now, one time, I was caught with one of them, and immediately they chased me out of school. This is a sexual network game. I learn a lot. When I'm having a girl, and then I play sex with. If the girl is having HIV, I can get the disease from her. Because I found that when I abstain from sex, I can live longer.
The hop, skip and jump game is another simple interactive tool that simplifies concepts in gender-based violence. It allows group discussion, self-reflection and action.
This game is to allow you to understand much more about the gender-based violence. You will hop, skip and jump out of the game, and we will be having another 4 participants. Also, they are going to introduce for us the consequences.
It fosters possible solutions on gender-based violence in homes, schools and the community, including seeking services available to the community and redress if violated.
I'm a physical violence. Mega man, you are Timo. Better Luane. Anya Lueno. Alwenyo Kedo Warena. I made it to do Kakaname. When you were an hour. Project Olaha. Let me better. Atame. Tiate. Kedan Atame. War of the come. Kedan Atame. War J community. Keda Atame. Near war born you are lere. Keda Atame. War dano. Atidi Nadana did do shoot.
This project has breached social norms and boundaries in communities, which would never discuss bodily changes in girls and boys. In the end, the young person has to find his or her own answers. Male peer educators are comfortable leading group discussions on menstruation and giving advice using the Jaraway apron.
Before I was trained, I was very challenging. So I doesn't know how to talk to girls if a girl is having actually during menstruations, because during those days it separates girls and boys. So therefore, I always feel scared. You need to go and seek medical advice. So I think that menstruation is a disease, it's a very sick disease. After I was trained, I've learned that menstruation is actually a daily thing that happens, that it is a normal situation.
But for me, last time I can't know how to use with a pads. But today I'm now how to use with a pad, how to control myself, how to use with other things.
Before changing others, the peer educators have found they first have to change themselves. After selection as a peer educator, Dennis had to rethink his drinking habits. He eventually stopped drinking in order to become a believable role model.
As I've been selected as a peer educator before, I was a gangster. But when I've been trained to be peer, still, sometimes I feel that appetite of taking those alcohol and cigarettes, and sometimes I did it. One day, I was doing my activity. Then this flip chart was brought. Then I said, I'm going to use this flip chart. Then the message from the flip chart and the way people that usually took alcohol, the way they behave in a wrong manner. I continue with this flip chart, spreading those good news to my fellow friends, like Jimmy.
Thank you. For me, I was not a good person. Some years back, I was so much addicted to alcohol drinking, smoking, and some other bad behaviors. But it was this year, around April, that I heard of a program that was organized by Plan Uganda and CDFU. I was having a girlfriend. When we are together, for me, I'm not always accepting her idea. Sometimes I do force her to have sex with me when she's not ready. So this really affected our relationship. And in fact, we break the relationship just because of alcohol. It changed my life actually. And it made me to know that forcing my girlfriend to have sex with me, it is a gender-based violence. CDFU and Plan Uganda, please. I've seen the importance, I've seen the benefits, not from somebody else, but from me. I've seen the importance of this. ASH programs. It's changing life.
An important aspect of the project is youth-friendly services that enable youth to feel free to seek consultation and ask for the services they need.
Thank you for calling the health hotline. How may I help you?
I'm calling from Lera district at the sub-county called the sub-county.
A hotline is a telephone service that addresses the unmet need of youth-friendly information, counseling, and referral services. It's just by a click of a button and you can reach us. We can be reached on all networks all over the country. And the beauty with the hotline is that there's a lot of confidentiality and anonymity. We attend to our 300 calls every day, and up to date, we have attended to over 2,000 calls from Alepton and Lira districts.
The project has encouraged adolescents to utilize available services such as the toll-free hotline, health centers, and the youth centers like the Bar ICT Center.
Bar ICT is a CBO, and we operated now 7 years. The activity we are having here, we do the computer training. We have the library, whereby we give out to 10 schools. And we also have the storytelling program, the youth dialogue, the DSTV. If you are to check on the number of the people who is doing ICT, it is because of the ASRHR program.
To create an enabling environment for young people, the project has involved the local leadership, faith-based and cultural leaders, parents, and service providers, and oriented them on the needs of their children.
The outcome of war, we have poverty, which affected people overgoing sub-county, and the only solution to these young girls was to go out and sell themselves to earn a living. When this program came up, they sensitized the young adolescents how to behave, how to participate actively. As a woman leader, I also want to see future ladies coming up, getting the same education that I got to come and replace me.
Yeah, the program has been so helpful to me in particular. It has helped us to talk to our people, to sensitize them, reducing the rate of sexual gender-based violence. It has helped even the parents to know what they're supposed to do to their children.
The partnership between CDFU, Plan International Uganda, and Plan International UK has been an effective one.
One of the best approaches we would do it was to look at how we could engage a partnership understanding in order to successfully, effectively, and efficiently deliver the adolescent sexual reproductive health program in Lira. And out of that, we sought out partners that have more knowledge, skills, and have experience in delivering adolescent sexual reproductive health services. And out of this, we realized that CDFU was one of the best partners that we would engage to be able to provide these services to the communities.
We have had actually a first time but very fruitful relationship working with CDFU over the last 2 years. Because it was a requirement by the donor that when we were applying for this grant that we had to work through a local civil society organization. So part of the responsibility for Plan was to ensure that there is capacity building for the local civil society organization, because that's one of the ways towards the sustainability. But of course, CDFU was charged with the responsibility of day-to-day implementation of the project on the ground.
The synergy has come out very well because everybody knows their role and every one of us consults. We do consultation, we do review on a regular basis to understand our roles even much better and to pick from each other's strengths. So the synergy which Plan UK wanted was to make sure the rights-based approach is integrated, but also to ensure that Plan Uganda and CDFU implement this project
based on the principles, strategies, and components of sexual reproductive health.